So what is the Emerald Programme? This is a project over 5 years funded by the European Commission to achieve mental health strengthening in low and middle income countries. Specifically, there are 6 countries involved: Ethiopia, India, Nepal, Nigeria, South Africa and Uganda. And together with colleagues from the World Health Organization for Centres in Europe, we're working together to find ways to make a clearer case to governments for the investment in mental health, establish ways to measure progress, and to offer skill upgrading for service providers, for policymakers, researchers, and for patients and service users and caregivers. So the programme as a whole is an integrated approach to strengthening systems for better mental health care and for more mental health care in low and middle income countries.
It's going to help us to help the low and middle income countries to bridge the mental health gap which has been found to exist within these countries. First, it will help us to learn how to deal with the policymakers, how to lobby them to increase the financing of the mental health services, and also to increase on the human resources.
The innovation that the Emerald bring is that we are working across the variety of stakeholders, not just in one country, in other participating countries, but also in other countries that are not participating but share the same kind of health system.
Through the first 2 years of the Emerald Project, I've really realized that despite the fact that our countries are so varied, they actually share a lot of universal challenges. The efforts of all of us combined is much more effective than one country working on its own to scale up mental health services.
Impact of Emerald will be at different levels. It could be at the national level. We are looking at better understanding of integration of mental health services into the existing interventions. Then we go down to the district level. The most interesting thing is the empowerment of the users, the empowerment of the districts, the empowerment of the communities.
So in an unmapped and misunderstood system, the best of our interventions might fail. And this gap is something which Emerald focuses on, and this is something which is definitely going to make a difference for future, because there are very few initiatives till now which have looked into the systems aspect of mental health.
Increasingly now, we have strong evidence in low and in middle income countries that we have effective treatments, we have affordable treatments, that many people who have these conditions will recover, often within weeks or months, and then go back to the productive and active contributory lives in normal society. So we have the technology to do that. What we're working on now, and which is gradually coming, is the understanding among governments about the impact of mental illnesses and support for mental illness within the whole realm of non-communicable and chronic diseases as a public health priority across the world.